There are more than 120 types of tumors that can develop in or around your brain. Some tumors are malignant or cancerous and can grow quickly and spread throughout the brain. You can also develop benign tumors, which aren't cancerous and grow slowly. However, even benign tumors can lead to problems as they grow within the enclosed space of the skull. Glioma is the broad term for many different types of tumors that arise from the substance of the brain. These types of tumors often develop from the glial cells that support the nerve cells and commonly arise within the cerebral hemispheres of the brain. A glioblastoma is the deadliest type of these tumors and is the most common type of primary brain cancer. Meningiomas are tumors that grow from the layers of tissue that cover your brain and spinal cord. When they get bigger, the tumor can press on nearby brain tissue and produce a variety of symptoms. Schwannomas are tumors that arise from the cells which insulate the nerve fibers of the body. They often involve the vestibular nerves for balance and can lead to hearing loss. Brain tumors can develop from DNA mutations due to exposure to toxins or for no specific reason at all. What are the symptoms of a brain tumor? Brain tumors can affect people differently, and not everyone experiences the same symptoms. In some cases, tumors are only found accidentally during an evaluation for another injury or health issue. When you have a tumor that presents symptoms, they can include seizures, headaches, vision changes, speech difficulties, weakness, balance problems, changes in personality, and loss of hearing. Because these symptoms can relate to many other conditions, it's important to promptly get your condition evaluated. Contact me via my office, and I will help you. Spine surgery Q&A. What is spine surgery? I offer a variety of spine surgeries to correct different spinal injuries and degenerative conditions. The goals of surgery are to repair your spine, relieve your symptoms, and help you get back to your regular activities. Some common spine surgeries include laminectomy. The lamina is one of the walls on your vertebrae. I can remove your lamina in part or in its entirety to create space in your spine. This procedure can relieve painful nerve compression. Discectomy. During a discectomy, I remove a herniated spinal disc that compresses a nerve root or your spinal cord. I often combine this procedure with a laminectomy to relieve sciatica and other types of nerve-related back pain. Spinal fusion. Spinal fusion connects two or more vertebrae to increase stability in your spine and correct some spinal deformities. I use bone grafts or surgical pins to fuse your vertebrae. Foraminotomy. Foraminotomy enlarges the opening that allows a nerve root to exit your spinal canal. It relieves nerve compression and can reduce symptoms caused by a herniated disc or thickened spinal joints. Vertebroplasty and kyphoplasty. Vertebroplasty and kyphoplasty are procedures to repair compression fractures in your spine by creating space in the vertebra and filling it with special surgical cement. These procedures can relieve nerve compression and correct abnormal curves in your spine. I use minimally invasive surgical techniques whenever possible. Minimally invasive surgery reduces trauma to the surrounding muscle, connective tissue, and bone. Minimally invasive surgery also reduces your risk of complications. Why would I need spine surgery? When conservative treatments for back pain don't relieve your pain and other symptoms. I offer expert spine surgeries to address painful problems, including herniated discs, spinal stenosis, vertebral fractures, degenerative disc disease. If you're frustrated by back pain and need to talk to an expert spine surgeon about your condition, make an appointment with me at Farin Neurosurgery. I provide comprehensive consultations and exams to identify the best treatment to relieve your pain. What should I expect after spine surgery? Depending on your condition, you might need to spend a few nights in the hospital while recovering. I provide personalized aftercare instructions before releasing you.